women can feel that they're losing their minds, that they're suffering from mental health problems they've never had before, and the plates are starting to fall, having been spun very successfully for a long period of time. Women are sometimes, when they reach the point of an appointment, are feeling that everything is coming down.
In cafes and community spaces across the world, people come to drink tea, eat cake, and chat about the menopause. I co-founded the world's first menopause cafe in Perth, Scotland, and I know conversations about this inevitable life change can be comforting, uplifting, and eye-opening, given the menopause has been a hidden or even taboo subject. People usually come in knowing about the physical symptoms of the menopause, but the psychological symptoms are often a shock and can have a huge impact on our mental health and well-being. Brain fog, irritability, anxiety, low mood, women can be left asking, am I normal? And when they go to their doctor, the nature of these symptoms mean some women are dismissed or misdiagnosed and even given inappropriate treatment. The typical age at which this happens to us coincides with when the suicide risk for women is highest. It's a crucial time for our mental health. So what can GPs and others working in primary care do to support good mental health in perimenopausal or menopausal women? I spoke with Sam Brown, a GP specialising in menopause, and with Karen Arthur, creator of the Menopause Whilst Black podcast, about their experiences and advice. Karen, I wondered if you could kick off by just briefly saying how the menopause can affect our mental well-being while we're going through it. What kind of impact can it have? Mm-hmm.
So for me, I started to feel just different. I didn't feel right. I lost the joy of all the things I used to love. I didn't particularly like my job. I felt trapped. I felt like I had no choice. And then on top of that, I felt guilty for feeling all these things because from a physical point of view, I had enough money, I had a house, all these kind of things.
What I'm finding with patients is they often come in putting those problems down to other things. Really not sure if I should come in, but I just don't feel myself, exactly as Karen said. They feel a bit detached from their body, like everything's happening somewhere else. They're not quite present. They may feel that everything, walking through treacle, everything is hard work. There's no motivation to do things that they know they enjoy, and there's not as much enjoyment when they have them.
Even getting in front of a GP in the first place can be very difficult. Our symptoms often fluctuate. Awful one week, fine the next, and this can be a barrier to us coming in. Busy jobs, kids, and elderly parents mean finding the time for an appointment is a challenge. Cultural differences too. Family or elders may think women should just be getting on with things and not making a fuss. So it's worth bearing in mind that patients may have struggled to even get in front of you, and that simple ways of starting an open, trusting consultation can have a big impact.
So my first experience was when I was suffering from a low mood, and I now realise with retrospect that I was perimenopausal, fully perimenopausal. So I turned up to the doctors, and he didn't look at me. He carried on making notes. I don't know what he was doing, and I felt like I wasn't there. So I left the GPs and I called my sister, and she told me to go straight back in and make an appointment with somebody else. And the second appointment was completely different. He looked up, he smiled, he put his pen down, he sat back and he said, "How can I help you?" And just those words, just that acknowledgement made such a difference to my experience.
It's important to open up the conversation and not feel overwhelmed, that this is actually not one problem. It's not just tiredness. It's not just brain fog. We are dealing with a whole host of symptoms, and the solution to that will be very different for each person and needs to be holistic. And you can feel overwhelmed that you're expected to do that in 10 minutes, and you're not expected to do that in 10 minutes. What you can do in 10 minutes is listen, acknowledge that this problem may be related to that person's hormones. You can send them away with some information about HRT. You can send them away with some information about the risks of breast cancer, and you can bring them back. And you can use that time, as we do with many other conditions, to form a relationship with that person, to form a trust, and to explore the options so that they feel empowered to make the right decision for them.
The menopause has a range of symptoms. These can fluctuate and also mimic other conditions, making timely diagnosis difficult. Many women at the cafes tell me they have had multiple medical appointments, often with different GPs, before they felt listened to, and that their symptoms were being attended to.
I think that the important thing is to be aware of the mental health impact of perimenopause. When women come of a certain age saying that they are feeling anxious or depressed and they haven't ever had that before, then to change the questions a little bit and ask, could this be related to your hormones? What are your periods doing? If a woman feels that their symptoms may be related to menopause, then using a symptom questionnaire is often really useful, and it's well worth taking the couple of minutes to go through that, because I think often it's surprising to that woman and her doctor how much impact these symptoms are having. I often think back to patients where they were referred for their palpitations, they were referred for their dizziness, saw lots of specialists about that. They were referred for rheumatology, psychiatry. I think women who are getting frequent referrals for seemingly unrelated symptoms, I think be aware of that. Fibromyalgia, chronic fatigue syndrome. I've had patients respond really well to HRT, and they've had those conditions for years.
Menopause was a wake-up call to take responsibility for my own health and look after myself better. I started exercising, eating better, accepting that I now have limited energy and I need to choose carefully where I put it. I can't keep looking after everybody and pleasing everybody, and that's quite a shock for some women. HRT and other pharmacological treatments are options, but lifestyle changes can have a huge impact. We need to know that it's a long haul and that our GP is in it with us.
I think this is exactly as you say, a pivotal time. So this is what worked for us in our 20s and 30s is not going to work going forward. We want to live a long and healthy life, but we're going to have to put in some effort. So I always talk about self-care, exercise, alcohol, diet.
I feel like that sense of empathy and looking at the bigger picture is so, so important. And certainly, I mean, when I went to the doctor, I was petrified, but my focus was elsewhere because I was worried about the fact that I couldn't do my job and I thought I was going to get the sack. So in a sense, I wasn't listening to anything about menopause. I just wanted fix me so I can go back to work. But actually, it was a time of it was a reckoning for me, certainly. And it did mean that I left my career behind. And at the time, that was devastating.
Karen's experience with her job isn't uncommon. Many women I've spoken with have left a job due to their menopause symptoms. Good news for those working in primary care is that you can be a lifeline for those of us who feel isolated, confused, and frustrated. A good GP who will see us through is a godsend. Sam told me it's also the most rewarding thing she has done in medicine.
It's the most rewarding thing to have that phone call a month or two down the line, whatever route that woman has chosen to take for her treatment. The fact that you listened, you helped unravel, you helped signpost, you normalised, she felt heard, and then you follow up in a couple of months and things are so much better. It's one of the loveliest phone calls. You have done it in a very low risk way. You haven't prescribed anything that's controversial, difficult, dangerous. You may not have prescribed at all. But I think, yes, it's one of the most rewarding things in medicine to get right.
When people come out of a menopause cafe, the top things they say are, now I know I'm not alone. And now I know I'm not going mad. So if you as a GP can reassure us that we're not alone and we're not going mad, that's a huge weight off our shoulders.